Go ahead and get started today. Thanks for joining for the NCCOR monthly call. Our agenda today, there we go. As usual, starting with opportunity for anyone to share emerging opportunities for NCCOR, followed by update on steering committee activities, and then happy today to have Matt Gilman from NIH, who's going to give us an update on the ECHO project and initiative. Then we'll hear from Amanda on our communication work, and then have an opportunity for anyone else on the phone to share updates from their NCCOR projects or any other announcements going forward. So with that, I'll open it up to see if anyone has any opportunities they'd like to, new project ideas, et cetera, they'd like to share with folks on the phone today. All right. Well, did someone have a comment? Okay, I think that was just some background noise. But if folks, if ideas come to you, we can revisit that at the end during the announcements part. So in terms of the steering committee update, we're sad to announce that Tina Ko had to, resign from the steering committee due to other commitments at the foundation. But happy to have Jamie Bissell from Robert Wood Johnson. She's leading their childhood obesity portfolio right now, especially a strategic planning process to identify their upcoming priorities. So we're excited to have Jamie as a member of the steering committee. Second, I think folks on the phone know that for our March member meeting, we're also having that as a senior leadership briefing where the senior leaders from each of the 4 partner organizations come in person to hear about NCCOR's recent accomplishments and to give their thoughts on what NCCOR's strategic direction going forward could be and what their priorities are. So we're in the process of planning that agenda. We had a prep call with the senior leaders a little over a month ago to get their thoughts on what they'd like to see and what they'd like to hear about, which was very helpful for the steering committee and for the coordinating center. So as we get closer to that March date, we'll be sharing materials for everyone on the phone as well as the senior leaders and the agenda for that meeting. So we're excited about that. I think the last one was in 2015. NCCOR's done lots of exciting things in the meantime, and there have been some new leaders come on board at different member organizations. So we're happy and excited to convene them again and hear their thoughts. Any steering committee members on the phone want to add anything? All right, well, moving forward, some of the folks on the phone may know that the European Union has funded an initiative that's their Science and Technology and Childhood Obesity Policy initiative, which is focused on identifying what works to reduce childhood obesity in the EU. This is an initiative that Elaine actually became familiar with in a trip to the UK that she had on another project. So the NCCOR steering committee and a few other folks had an informational call with the STOP project to see if there were any synergies, if there was anything we could help them with, any lessons they may have for us. The key next steps there are less of it becoming a formal NCCOR partnership with the STOP initiative and more us connecting them with some key research projects and evaluation projects here in the U.S. so they can talk directly with the leaders of those initiatives and share, ideas back and forth around measurement and surveillance and intervention design, et cetera. So it was very useful, and we'll likely have some annual follow-up with them to see if there's any, to touch base to see if there's any emerging opportunities for coordinating with them or, them sharing with us what they're learning in the EU that may be applicable for the U.S. Any folks who are on that phone want to add any thoughts or comments from it? Okay, well, we'll keep on going. And lastly, the Department of Defense reached out to a few NCCOR members and expressed a new priority they have in terms of addressing childhood obesity, specifically in the southeast U.S., related to, of course, having a larger pool of folks who would be physically fit and able to, for military readiness. And so we are planning a exploratory call with a few folks from the Department of Defense and some steering committee members to just discuss what a potential partnership could be and to learn more about what their needs are and their resources are. That's currently scheduled for December, and so once that occurs, we'll give a report back to the NCCOR members on our January call for this group. Any other updates from the steering committee? It looks like Jamie is on the call. Jamie, do you want to say hello as a new steering committee member? Okay, Jamie may be on mute or just listening through the computer. So why don't we go ahead and move forward. We're also happy to announce a new work group. Or Amanda, do you want to give an update on this?
Sure, and I think Jill or David are on the call to speak afterwards. For our JPB grant, we're going to start working on our third task of the grant, which is called Define Next Steps and Measurement Needs to Accelerate Progress in Reducing Childhood Obesity. We like to keep those names as long as possible, so we're sticking to that. So we've just started some initial discussions with the work group leads, and we will be, we're opening a call out now for work group members, but we'll again sort of announce a call for work group members in January. But in the meantime, please feel free to email me if you want to join this work group. Jill or David, do you have anything else you want to add?
Sure, Amanda. This is Jill Reedy from NCI. And I just wanted to follow on with what Amanda said, that we've got a really great group that's active and with representatives from CDC and USDA and NIH, and we're really excited to get more involvement from across all of NCCOR as we continue to move forward. And like Amanda said, we'll continue to have some ongoing opportunities to participate in these efforts. So please follow up with Amanda, talk with us. We're excited about this work. Thanks.
Great. Any questions for Amanda or Jill? All right. Well, next, we're happy to have a presentation today from Matt Gilman from NIH, who's going to talk about the ECHO project at NIH. So, Matt, I'll turn it over to you.
Thanks so much. Can everyone hear me? I'm off mute. Can you hear me now?
We can.
Yes, Matt, we can.
Great. Okay. Thanks a lot for having me. The last time I attended NCCOR, I think, was a couple years ago, right after I had taken this job to direct ECHO program. A lot of things have happened in the last couple of years. I wanted to give you a flavor of obesity-related research that's just getting off the ground and some of the future possibilities. Also to say it's great to see a lot of familiar names, even if I can't see faces, and to meet the rest of you that I haven't met before. Some of you I actually saw a couple days ago at the NIH Obesity Research Task Force, so some of what I'll say you've heard, but a little bit is new as well. So let's see. So I thought I would talk about our obesity-related observational and intervention research, because in ECHO we have the ECHO-wide cohort, which is observational, as well as the Idea States Pediatric Clinical Trials Network, which is interventional. ECHO is a nationwide program, so we are in 44 states, DC and Puerto Rico. We have about 250 performance sites, about 1,300 key personnel across these sites in the United States. And under the umbrella of ECHO, we have our 7 components. As I mentioned, we have our observational studies and our clinical trials, and then we have the supporting cores and centers, including Coordinating Center, Data Analysis Center, CHEER, which is the exposure analysis resource for measuring environmental chemicals and metabolomics. We have our person-reported outcomes core for measurement, especially self-report, and our newly established genetics core. So within the cohorts, we have 31 awards, 68 PIs, and over 60 cohorts. You can see also spread geographically. And the overall scientific goal in the cohorts is to answer what we're calling solution-oriented questions about effects of a broad range of early environmental exposures on child health and development. And by a broad range, we mean exposures that range from physical and chemical, which people sort of first think about, but also the things that I think the agencies you represent also think about, so societal factors, medical, psychosocial, behavioral, and biological. Somewhat arbitrarily, ECHO defines the exposure period as conception to age 5, and we're interested, of course, in things that fit into the paradigm of developmental origins of health and disease, or you might also call this the life course approach. Our health outcomes span from childhood through adolescence, and they include these 4 high-impact conditions, or sets of conditions: pre and perinatal, upper and lower airways, obesity, which is our focus today, and the many facets of neurodevelopment. In addition, we've added a 5th outcome called positive child health, which is not the absence of disease, but it focuses on assets that enable well-being, such as happiness, life satisfaction, meaning, purposes, relationships, achievement. And the working group on positive child health has also adopted sleep as one of its foci. So within the ECHO cohorts, our overall goal has been to create this ECHO-wide cohort. So all of the cohorts existed when they came into ECHO. So we start with the existing cohorts of moms and kids. All of the cohorts are following up the children, and some are still recruiting in pregnancy. And the idea is to establish a single data platform to conduct etiologic and prediction research in which we are, to the extent possible, harmonizing existing measures and standardizing new measures. And this is a bit of a trick because we have what I've been terming a dynamic cohort of inception cohorts. These cohorts were recruited at different points in the life course, as you can see, and also in different eras, and so they have different visit schedules and different data collection schemes. So it's a good thing we have a good data analysis center. One of the things that we've been really concentrating on in these first couple of years is to develop a data collection protocol for the ECHO-wide cohort. So cohorts may have come in with a focus on asthma or a focus on obesity or a focus on ADHD. And we've asked them all to take their majors and add the minors. So these are all omnibus cohorts at this point. And so we've, through the protocol, been able to establish what we're calling essential data elements, which is all cohorts are required to collect these. And within the essential data elements, we have the preferred measures, typically a nearly gold standard or a brass standard for epidemiology, an acceptable measure, which may be, say, a shorter version, and an alternative measure recognizing that since these cohorts have been existing for a long time, there might be a legacy measure that's harmonizable with the preferred measure. There are also some recommended elements in which we specify a preferred measure, not the other 2. And these essential and recommended data elements span the different periods of the life course, from even preconception with a couple cohorts through prenatal all the way to adolescence. To underpin the work we're doing in implementing and evaluating the protocol, we've established these policies for publications, data sharing, and biospecimen use. So you can think of the ECHO-wide cohort as weaving together these 60-plus individual cohorts into this platform, which is many people, many layers of data over many stages of the life course. And the idea is to have an ECHO-wide cohort with 50,000-plus children and their families to address questions that no single cohort or even a few cohorts can answer alone. I mentioned solution-oriented research. which is really the focus of our strategic planning. And what we mean here is that we want to create the evidence base so that there'll be impact on policies, programs, and practices. And one of the ways we would like to do this, and we're just starting this, is to engage our end user stakeholders not only in the back end for dissemination, but on the front end, so that we can identify the research questions that will have the most impact. And I think that might be of interest to the folks on this call, given the different agencies that you represent. And we've already had some work in that regard, which I'll tell you about in a moment. In the end, this is a nationwide research collaboration, which is meant to be a resource for the entire scientific community. And you can see in this slide how we're creating that resource. So at the top here, you can see that the ECHO cohorts collect data under the protocol, and on the blue arrow going downwards, they deposit these data every 6 months in the Data Analysis Center in the platform. On the right, you can see that this is in a restricted use enclave, so the database contains some identifiable information, and so there's highly secure access. And on the left side of the orange part, you can see that all the investigators who want to do data analyses must go through, the analysis proposal process that's been approved by the steering committee. Right below that, you can see that 6 months after ECHO investigators have access, the data will be available to all non-ECHO investigators as well. And on the bottom, in the green, there are plans in the future to create what we might call a public use data set, anonymized, with fewer access controls, not requiring proposals for analyses. Let me tell you just a little bit about obesity-related work. So first I wanted to dive just a little bit deeper and show you some things about the protocol itself. Again, these are essential and recommended elements across the life stages. So on the left-hand side, you can see a table with X's marked in the life stages for which each of these elements is appropriate. Some are about the family, some about the mother, some about the child, some about the father. And you can see that they span quite a range of exposures. On the right-hand side, you can see a little bit deeper dive into the things that we're collecting on diet, on physical activity, on sleep. BMI and skin fold thicknesses are essential. Some are doing DEXA and MRI in subsets, so those would be like the legacy measures. And subsets of cohorts are assessing mother or child microbiome, epigenome, metabolome. I wanted to point out that the dietary measures have been partly in response to the FDA-NIH Joint Advisory on Nutrition, so we highly appreciate their input. While we've been creating the ECHO-wide cohort, the cohorts have not been idle. Again, because they came in with their own aims and their own histories, they've been continuing to do their own analyses, so there are 100 or so published to date with ECHO funding. And I wanted to point out a collective analysis on obesity that's going on within the cohorts. So you can see here 10 of the 31 cohort awardees who have obesity as a special focus, and their specific aims are related to, but not limited to, mediation of exposure outcome associations by biological behavior pathways, effect modification by a priori hypothesized factors from genes to society, quite a bit of emphasis on toxic exposures like air pollution and metals, as well as endocrine disrupting chemicals. And as I'll point out on the next slide, thinking about critical or sensitive periods for emergence, resilience, or resolution of phenotypes through things like trajectory analysis. So on this slide, you can see from one cohort trajectory analyses that have been done and published just a few weeks ago in the Journal of Pediatrics. On the left-hand side, you can see the curves related to parental obesity. So these are BMI curves for children. and on the top of that curve is the orange curve where both parents are obese. On the bottom is the blue where neither parent is obese, and in the middle where one or the other parent is obese. And what I wanted to point out on this slide is if you look on the left-hand side of these curves, you can see that they diverge in infancy. So with this particular risk marker, parental obesity, it might be that if you want to mount an intervention that takes account of that, it could be as early as infancy. And contrast that with the one on the right, which is related to maternal smoking during pregnancy and its association with childhood BMI trajectory. And here you can see the green line, which is the top line, is the BMI trajectory of those whose mothers smoked during pregnancy, and the bottom lines are those who didn't. And in contrast to the one on the left, here the curves diverge in early childhood. So these are very simple. They don't take account of multiple factors, but if done within the context of the echo-wide cohort, I think these could take into account more of the complexity of the multiple predictors and give us an idea about the timing, so we leverage that for best interventions. So I also wanted to point out this collective analysis that's being done by a number of our investigators, as yet unpublished, so these are preliminary data. So this involved, of the 84 cohorts that were funded in the first two-year phase, 70 of them, resulting after exclusions of basically a repeated cross-section that includes 37,603 kids. And this is an example of a distributed data analysis where the meta-analysis is done on the level of the cohort. So the Data Analysis Center creates and refines a program to send to the cohorts. And the cohorts, before their participants have provided informed consent to share data, are able to do the analyses behind their firewalls, create tables of these data, and send them back for meta-analysis. So they collected self-report or medical record abstracted data on age, sex, race, ethnicity, length and height and weight, calculated the BMIs, and sent the tabulated results back for meta-analysis. And just showing you a couple figures from this preliminary analysis. Here we can see for all participants, for non-Hispanic whites, blacks, Asians, other, and Hispanic participants, that obesity in the age range of 2 to 18 years is more common in the older kids. So those are the right-hand bars within each of the race ethnicity categories, as well as in blacks and Hispanics. So these are not surprising data, but it shows that ECHO has the data to do this kind of analysis, as well as with a large sample size to be able to show similar patterns for extreme obesity. Again, this is within the 2 to 18-year age group, and here you can see again that non-Hispanic blacks and Hispanics typically have higher prevalences than in the other race ethnicities. And in those categories with enough data, the prevalence of extreme obesity is higher at older ages. And one of the nice things about these data is that the prevalences, both by age and by race ethnicity, are close to what we see in NHANES, suggesting that the ECHO data, if not representative, will at least be somewhat generalizable and shows the diversity of these cohorts. So just in terms of the ECHO cohorts generating the kind of data to help lessen the burden of overweight and obesity, this is just a snapshot, but the ongoing recruitment and retention offers the opportunity for large longitudinal data within the large sample sizes. So there's sufficient power for subgroup analyses like I showed you, and to really look at study exposures during these sensitive developmental periods. The protocol itself promotes universal collection of environmental exposures and the outcomes so that on a larger sample size, our investigators will be able to study pathways and mechanisms that promote obesity and overweight. And within the Idea States Pediatric Clinical Trials Network, there's the opportunity in the future to test novel interventions. And I just want to let you know at the end of this talk a little bit about what's going on in the Idea States Network. that's related to obesity. The ISPCTN, as we call it, comprises 17 clinical sites. Here you see in these states, they're IDEA states, which means they have historically low rates of NIH funding. And it has its own data coordinating and operations center at the University of Arkansas. The idea of the network is to provide access to state-of-the-art clinical trials among medically underserved and rural populations, while at the same time building capacity for pediatric research across these states. That capacity is actually to conduct the trials, so through professional development and infrastructure and team support. Within the first couple of years, we're seeing 2 obesity-related pilot trials that are homegrown. This is in addition to other trials not in obesity, so for example in maternal child opioids that we're doing in collaboration with other NIH networks. So those 2 pilot trials include one that's called Vidora, vitamin D supplementation in children with obesity-related asthma. So the background is that we know that obesity and asthma coexist. Vitamin D levels typically are lower among children with obesity. It's possible that vitamin D supplementation may alleviate asthma symptoms, but we have few data on how much vitamin D is needed to achieve adequate levels in children with asthma and obesity. So this pilot study is to characterize vitamin D pharmacokinetics among children who have both obesity and asthma and either insufficient or deficient vitamin D levels, with some exploratory endpoints of inflammatory markers and asthma control. It's a 16-week pilot trial, which is, as I said, focused on the pharmacokinetics. And it's to inform a potential efficacy trial that could be done in the ISPCTN or possibly in other networks. And then in addition, there's a feasibility pilot for a study that investigators would like to do called I Am Healthy. And so the background here is that in urban and suburban settings, interventions to moderate weight gain among school-age children with obesity do appear to work if there are enough contact hours, but access is more challenging for children in rural areas who have higher obesity risk. So the overall goal of a potential I Am Healthy intervention is among rural children to assess an intervention to reduce weight gain among these kids with group-based behavior change using distant tablet technology. So here you can see a potential 32-week intervention using iPads where kids to get together in groups with coaches. And, sorry, the next slide shows that the pilot trial is really to look in 6 primary care rural practices in these states to assess approaches for participant recruitment and retention, to test out intervention dose, and see if staff blinding can be achieved, given that these are done through clinics. So just in summary, I'd like to say that ECHO supports observational intervention solution-oriented research related to childhood obesity and related to the other outcomes that I've told you about. The ECHO-wide cohort is approaching 50,000 children and their families to look at how a broad array of early environmental factors is associated with these outcomes. And that's paired with our IDEA States Pediatric Clinical Trials Network for rural and underserved children. And there are opportunities to collaborate come along not only for investigators, but we're hoping across NIH and our partners outside of NIH. So thanks very much. I'm really happy to answer any questions.
Thanks so much, Matt. Such interesting information, and it's an amazing program. We're going to learn so much. I want to open it up for questions for a few minutes. Does anyone on the phone have questions for Matt?
Happy to answer verbally, or I see there's a chat room as well.
Yeah, on this call, generally folks can just unmute themselves and speak up.
Excellent.
Matt,
I'm happy to answer anything from general to specific. Sorry. Sorry, Heidi.
Hi, can you?
I interrupted you.
Oh, that's okay. Hi, Matt. This is Heidi Blank at CDC. So this is wonderful. This really gave a great overview of how those cohorts have come together and the opportunities. If we were to see opportunities, so for example, we fund a number of interventions in childhood weight management programs.
Mm-hmm.
And we have one that just closed, but we have a number of ideas. What is the best way to engage with you? Just to set up a call, or to go through the NCCOR mechanism, or what are your ideas?
Yeah, I think contact me, and I can either respond myself or have one of the people in our program office respond. I think it would be great to partner with CDC, given the kinds of interventions you do. What of our observational research or our intervention research could inform the kind of work you do? What would you like to know that would really help you design your programs? And likewise, what can we learn that will help us design the best studies? So I think it's a bi-directional thing. I also heard from just a couple days ago a statistician who works in one of the NIH institutes about some machine learning activities across HHS that might be able to link some CDC and ECHO data. So that's another possibility. I don't know the details of that, but we'd love to have those conversations. And this is kind of the time that we're seeing the light at the end of the tunnel of creating our systems and infrastructure and reaching out to partners.
Great. Thanks, Matt.
Thanks. Any other questions for Matt? Alrighty, Matt. Well, thank you for taking time to present on the call today. It's really helpful presentation. As you can see, there may already be some connections just from doing that, so thanks so much.
And people can be free to email me, so thanks again. Appreciate being here.
All right, great. Trying to get the slides to move forward. There we go. Now I'll turn it over to Amanda for a communications update.
One moment, I think we'll be able to fix this in a second. Apologies. Okay, I think it's coming back up. So for our communications update, this month we'll highlight an update on how our tools are being used and the promotion for that on NCCOR's National Childhood Obesity Awareness Month activities, as well as our session at APHA and some Connect and Explore. So for our tools, one of our goals of the JPB grant has been to really increase promotion and dissemination, and we've seen a consistent usage and increase in some of our tools. So the numbers are here. As you can see, we've had an increase in the user guides usage, as well as consistent activity on the rest of the tools. Okay. So we're excited to announce a new update of the measures registry of 188 new articles published between September 2015 and September 2017. A sampling of the measures are listed on the slide, one from each of the 4 domains. One note of interest is that many of the new measures are available in both English and Spanish, a higher amount than I've noticed in the past. I also just wanted to give a huge thanks to David Dargan and Jill Reedy, who reviewed all of the articles that were added to the measures registry. We also added or updated the FLASHY system in the catalog to include a new part of their data set, the GeoFLASHY data set, which includes neighborhood variables. As a reminder, if you know any systems that you think should be added to the catalog, please send them to Miranda and Jill Reedy. In September, NCCOR celebrated National Childhood Obesity Awareness Month, and we highlighted our multidisciplinary partnerships and our theme issue from the American Journal of Preventive Medicine. We also participated in a Twitter chat during September to help us reach new audiences. And we've had 3 Connect and Explore webinars in the last couple of months. The first was in September and was about the Healthy Community Study. The webinar featured Sonia Arteaga, Stephen Fawcett, Russ Pate, and Lorraine Ritchie. And it was highly recommended, as you can see from the results of our survey. And we had really high registration and attendance numbers. In October, we had a webinar related to the Health, Behavioral Design, and Built Environment Work Group based on a presentation they did at EDGAR last year. Speakers included Jerry Britton, Joel Kimmons, and Kimberly Rowling. And this webinar, interestingly, saw a much higher percentage of attendees from the nonprofit and private sectors than past webinars. Lastly, yesterday, we had a webinar by our ERS colleague, Michelle Seskena, on a recent report from ERS called America's Eating Habits, Food Away from Home. Initial survey responses show that people felt it was a good use of their time, and we also had a very engaged audience who asked lots of questions. We're really excited to have a joint session with the Food and Nutrition section and the Physical Activity section at APHA this year. We'll be highlighting the recent collaboration papers as well as NCCOR tools and focusing on case studies for each of the tools related to public health. So please help spread the word to your colleagues who are attending APHA. And we're excited to have Laura Kettle-Kahn, Jim Salas, Jamie Shariki, and Barb Ainsworth as presenters for the session. In addition, we'll have a booth. The number is 2021, so we will be there Sunday, Monday, and Tuesday, all during APHA, to meet with people to share NCCOR's resources and tools. And if you're at APHA, we'd love to have you stop by. Related to APHA, we've developed many new communication materials to share at our booth. These materials include a fact sheet on the Youth Compendia for public health practitioners, a new booklet on the Measures Registry, and a fact sheet on the Measures Registry geared for students. We also created a new fact sheet on steps to building a public health collaborative, and as well as one on the Childhood Obesity Declines Project.
All right, thanks, Amanda. Anyone have any questions for Amanda about the updating of the tools and the promotional work we've been doing? All right, and as Amanda said, if you're going to be in San Diego, please stop by and see us. We always have a lot of good traffic at APHA, and it's one of our best opportunities for reaching folks. So we're at the point where I just want to open it up and see if anyone has updates on other NCCOR projects they'd like to share today. Or as well, if you have any announcements or updates you'd like to share with the folks on the phone from your other work you may be doing. Okay, also wanted to announce that the coordinating center has brought on 2 new staff members, so I'm happy to welcome Rudy Karnick, who's here in our DC office. Rudy's going to be taking on a lot of the communication work with the newsletter, with publications, annual report, etc. And then Alice Gribben, who just joined us, and both of them in the past month, and Alice is going to be handling a lot of meeting prep and webinars and all kinds of good fun things. So welcome, Rudy and Alice. We're happy to have you as part of the steering committee, and folks on the phone, you'll start seeing their names or receiving emails from them. So just a few reminders. Our next member meeting, which will also be the senior leadership meeting, is on March 7th here in Washington, D.C. June 13th will be our Atlanta-based meeting, and then again September 12th back here in D.C. Our call schedule for these calls are up on the screen, so our next one will be on January 16th, followed by calls in April, July, and November of next year.
And so I'll just add that all of these calendar appointments will be sent out tomorrow via Alice. So look for, instead of receiving emails from Yanni, look to receive emails from Alice. And the member calls, as a note, are always at 2 o'clock. So those are when you'll be receiving those all tomorrow.
Great. Well, that wraps up our call for today. Any last call for announcements, updates from anyone on the phone? All right. Well, thanks again to Matt for joining us today and such an informative presentation. And happy holidays to everyone, and we'll speak to you again in January. All right.